Hey everyone, welcome back for another deep dive.
It's great to be back.
Today we're talking about something that I think we can all relate to,
Oh, yeah, for sure.
which is how to make the most of medical consultations.
Absolutely.
Because honestly, sometimes it can feel like you're kind of thrown into the deep end
Yeah, you really got to be ready for anything.
and you're trying to figure out what the other person is actually asking you.
Mm-hmm.
You're trying to, give them the information that they need.
Right, and do it quickly.
And in a way that they can understand it and use it. And, sometimes it just feels like a lot.
Yeah, especially when you're busy and you're trying to see all your other patients.
Exactly.
It can be tough to balance everything.
So what we're going to do today is kind of unpack some really interesting advice
Scott.
that we found. And it's funny because it actually comes from this guide
Okay.
that was about optimizing medical consultations for YouTube podcasts.
Oh, interesting.
But here's the thing. Good communication is good communication, whether it's on YouTube or in person.
Absolutely.
So we thought a lot of these tips could really apply to our everyday consults as well.
Makes sense.
So let's dive in.
Let's do it.
The first thing that this guide talks about is the importance of clarifying the ask,
Yes.
which seems really basic.
Yeah.
But you'd be surprised how often we jump into a consult without really making sure that everyone understands
Oh,
what
absolutely.
the question is.
Definitely. I've seen that happen so many times.
Right. So it's kind of like starting a road trip without agreeing on where you're going.
That's a great analogy.
You might end up somewhere completely different
Yeah,
than you intended.
for sure.
So the guide emphasizes that both the person requesting the consult and the consultant
Mhm.
need to be really proactive about communication.
I like that, proactive.
Right.
Yeah.
So the person requesting the consult needs to clearly articulate their concerns and their questions.
Hmm.
And the consultant needs to actively listen and make sure that they understand what's being asked. And this might involve asking clarifying questions.
For sure. Like what kind of questions?
So what you're really looking for is,
Right.
or can you help me understand the timeline you're working with?
Those are good ones.
Right.
I like those.
Because those kinds of questions can really help to set the stage for a much more focused and productive discussion.
Absolutely. You don't want to waste time going down the wrong path.
Exactly.
You get to the heart of the matter right away.
And speaking of productive discussions,
Okay.
another key point that this guide makes is the importance of direct communication.
Oh, I love that.
Right. They actually say
Yeah.
that the clinical note
Okay.
should not be a substitute
Interesting.
for a real-time conversation.
Okay.
And I thought that was really interesting because we often rely so heavily on documentation.
We do. Yeah. It's a big part of our job.
But it's kind of like trying to diagnose a patient based only on their lab results.
Sure.
You need the whole picture.
You need to talk to them.
You need to talk to the patient. You need to examine them.
Right.
And in this case, you need to talk to the other provider.
Exactly. Build that relationship.
Right.
Yeah.
So the guide really stresses the value of building relationships
Yeah.
and trust between providers.
Yeah. Because that leads to better communication
Absolutely.
and better patient care, ultimately.
Exactly, because when you have that direct communication,
Right.
you can pick up on those nuances,
The tone of voice.
the tone of voice,
Yeah.
the nonverbal cues
Yeah.
that a clinical note just can't capture.
Like if someone is really worried about something.
Right, or hesitant to try a particular treatment.
Yeah, exactly.
You might not get that from just reading a note.
Exactly. And that's so important for making sure that everyone is on the same page.
Absolutely. So that direct communication is really key
I agree.
to making sure that information is conveyed accurately
Mm-hmm.
and that everyone feels heard and understood.
Yeah, feeling heard is huge.
Okay, so now for a point that I thought was really interesting and honestly kind of a light bulb moment for me.
Okay, I'm intrigued. Tell me more.
So the guide talks about the importance of gathering data independently.
Interesting.
And at first I was like, well, yeah, of course.
Right.
But then I started thinking about it more and I realized how easy it is to fall into the trap
Yeah.
of relying solely on the information that's already been gathered.
Yeah. Especially when you're busy.
Right, and we've all been there.
Especially when someone you trust has already seen the patient.
Exactly.
Yeah.
But the problem is that we can be susceptible to all sorts of biases.
Oh, yeah, for sure.
Remember anchoring bias from med school?
Oh, yeah.
When you fixate on the first piece of information you receive,
Mm-hmm.
and then you might miss other crucial clues.
Yeah, that's a classic one.
Or recency bias,
Oh, yeah.
where you overemphasize the most recent data.
It happens to the best of us.
So the guide really emphasizes the importance of approaching each consultation with fresh eyes.
I love that fresh eyes.
Yeah. remaining objective.
And really thinking critically.
Exactly, and forming your own conclusions
Yeah.
based on a thorough assessment.
Based on all the available information, not just what's easiest to access.
It reminded me of this one case during my residency.
Oh, tell me about it.
So we had this patient with a really complex presentation,
Okay.
and everyone was super focused on a recent scan, but one of the senior residents decided to actually re-examine the patient.
Smart.
And they found this super subtle physical finding
Wow.
that everyone had missed.
Easy to do when you're just looking at a scan.
I know.
Yeah.
And it totally changed the diagnosis.
Wow, good catch.
It was a real lesson in the power of a fresh perspective
I bet.
and independent data gathering,
That's a great example.
because sometimes those little things can make a huge difference.
They can be the key to the whole case.
Exactly.
Yeah.
So it's really important to not just accept what's already in the chart,
Right.
but to actively seek out information firsthand.
Yeah. Do your own due diligence.
Right. And sometimes that might involve,
Like what kinds of things?
reviewing the patient's imaging studies yourself, talking to the nurses who are caring for the patient.
Yes, they have so much great information.
Right. They have so much insight.
Yeah.
Or even just spending a little extra time with the patient yourself.
Definitely sometimes they'll tell you something that no one else has noticed.
Exactly.
Yeah.
So don't underestimate the power of that independent data gathering.
It's so important.
It can really lead to those aha moments.
Absolutely.
That can make a real difference for the patient.
Love it.
Okay, so let's move on to recommendations.
Okay.
Because once you've gathered all that information,
You got to figure out what to do with it.
right, what are you actually going to recommend?
That's the hard part sometimes.
And this guide actually gets into some really specific details about how to format your recommendations.
Ooh, I like specific details.
Right.
Yeah.
So they suggest things like using generic names for medications,
Okay, good one.
providing specific dosage and duration,
Mm-hmm.
and even mentioning potential interactions and side effects.
That's really important, especially for complicated patients.
Right, because you want to make sure that the person implementing your recommendations,
The primary team.
right, has all the information they need
Absolutely.
to do it safely and effectively.
It shows that you've thought about the whole picture.
Exactly, and I think that level of detail is so valuable
I agree.
because it really shows that you've considered the patient's overall situation.
Yeah, you're not just throwing out random suggestions.
Right.
You've really thought about what's best for this specific patient.
Exactly, and the guide also emphasizes the importance of going beyond just the consulting physician.
Oh, interesting. How so?
They talk about taking the time to educate the nurses
Oh, yeah, the nurses.
and empowering them
Yeah,
to explain things to the patient and the patient's family,
love that.
right?
Yeah.
Because the nurses are often the ones who are spending the most time with the patient.
Absolutely. They're the eyes and ears on the ground.
Exactly.
Yeah.
So they're in a really good position
Mm-hmm.
to provide that ongoing education and support.
And to answer questions.
Right. And I think that really reinforces the idea.
That's a team effort.
Exactly.
Yeah.
That the consultant's role extends beyond just talking to the other doctor.
Yeah, it's about supporting the whole team
Right.
and ultimately the patient.
Absolutely.
All right.
Okay, so we've talked about clarifying the ask,
Yes.
direct communication,
Mm-hmm.
independent data gathering,
Love it.
and making clear recommendations.
It's all coming together.
But what happens when there's a disagreement?
Oh, that's a good question.
Right, because let's face it, it happens.
It does, yeah.
And it can be really tricky to navigate.
Especially when you're dealing with someone who has a different opinion.
Right.
Yeah.
And maybe a different level of experience.
Very sure.
So the guide emphasizes the importance of handling disagreements in a respectful and professional manner,
Of course.
always prioritizing the patient's well-being.
The patient always comes first.
Exactly. And they actually draw a parallel to other high-stakes fields,
Oh, like what?
like surgery or
Okay.
aviation,
High pressure situations.
right, where clear communication
Mm-hmm.
and conflict resolution
Oh.
are absolutely critical for safety.
People's lives are on the line.
Right.
You got to be able to work together effectively.
Exactly. So in those fields,
Yeah.
there are very specific protocols
Mhm.
and procedures
Yeah.
for how to handle disagreements.
So everyone knows what to do.
Right. And while medicine may not always have such formal protocols,
True, it's a bit more nuanced sometimes.
the guide suggests that we can still learn from those other fields
Okay, how?
by emphasizing clear communication,
Active listening.
active listening,
Respect for different perspectives.
exactly, and always putting the patient's needs first.
Sounds like a good recipe for success.
And any disagreement should be addressed privately and professionally.
Not in front of the patient.
Right. You don't want to undermine anyone's authority.
Or make the patient feel uncomfortable.
Exactly. So even if you disagree with the consultant's recommendation, you can still acknowledge their expertise
Right.
and express your concerns in a respectful way.
And try to come to a resolution together.
Exactly.
Yeah.
So it's really about finding that common ground.
Yeah. Teamwork makes the dream work.
Right.
Right.
Okay, so we're nearing the end of our deep dive here.
Okay.
And I want to leave you with a few final thoughts from this guide.
Sounds good. All right.
They actually provide a list of reflective questions
Interesting.
that they encourage consultants to ask themselves after each consultation.
Like what kinds of questions?
Things like, did you really listen?
Oh, that's a good one.
Were you genuinely curious? Did you build a connection with the other provider?
Those are all important things to think about.
Right.
Yeah.
And I think it's a really valuable reminder that consultations are about more than just delivering information.
It's about the human connection. Exactly.
It's about building relationships.
Yeah, and learning from each other.
And it's about continuous improvement.
Absolutely.
So I think these reflective questions are a great way to kind of step back and assess.
How did I do?
How did I do?
Could I do better next time?
Exactly. And the guide also encourages consultants
To get feedback.
to seek out feedback
Yeah.
from a trusted colleague or a mentor,
That's so important.
because sometimes it can be hard to see our own blind spots,
Absolutely.
and someone else can provide really valuable insights.
Yeah, they can help you to see things from a different perspective.
Exactly. And I think having that kind of mentorship can really help us to refine our consultation skills.
And become better clinicians overall.
Absolutely.
Yeah.
So here's the challenge.
Okay, I like a good challenge.
In your next consultation,
Yeah.
try implementing just one technique that we talked about today.
Pick one and go for it.
Maybe it's asking that clarifying question.
Mm-hmm.
Maybe it's taking that extra step to connect with the nurse.
Or gathering data independently.
Or providing really detailed recommendations.
Yeah, that's a good options.
Right.
Yeah.
Even those small changes,
They can make a big difference.
they can make a world of difference.
Absolutely.
So remember, consultations are an art.
It's true.
It's a skill that we're constantly honing,
We're always learning.
right? Growing. So embrace every opportunity to learn, to grow, to collaborate.
It's all about teamwork.
And each interaction
Yeah.
is a chance to provide truly exceptional patient care.
That's what it's all about at the end of the day.
Exactly. So that's a wrap on today's deep dive.
Thanks for having me.
We'll be back next time with another fascinating topic from the world of healthcare.
Looking forward to it.
Until then, keep learning, keep asking those questions, and keep those consultations thriving.
You got it.
See you later.
Bye.